and good morning, everyone. Thank you for joining us for today's Knockout Opioid Abuse Day Learning Series webinar. As Greg mentioned, this webinar series is a continuation of Knockout Opioid Abuse Day, which was designated as October 6th each year by Governor Murphy. And this learning series is designed to continue the awareness and education highlighted by that initiative throughout the year. Today's webinar is Childhood Trauma Part 2, Substance Use and Adverse Childhood Experiences. It is the second webinar in our series on this topic, and we are pleased to be able to bring this additional focus on this very important topic. This webinar series is brought to you by the Partnership for a Drug-Free New Jersey and is being held in collaboration with NJ Cares and the New Jersey Office of the Attorney General. And I thank them for their participation, their partnership, support, and collaboration on today's learning activity. Our featured expert speakers for today's webinar are Dr. David Levine from Atlantic Medical Group Pediatrics and Dave Ellis, Executive Director, Office of Resilience, the New Jersey Department of Children and Families. Before I turn things over to Dr. Levine, I want to welcome two individuals to provide opening comments who are on the front lines of this issue in law enforcement and who are going to speak about the Handle with Care program that was instituted last year by the New Jersey Office of the Attorney General. As a state, we are fortunate to have leaders like Chief Chris Lausner from the Middle Township Police Department and Assistant Special Agent in charge of the DEA New Jersey Division, Chris Yackham, who have made addressing ACEs in our community and state a priority. Good morning, Chief Lausner. Thank you for joining us today to give us an overview of the Handle with Care program. We'll go ahead and start with you.
Thank you, Angela. Welcome everyone this morning. I'm excited to be here and participate in this webinar. When I talk about ACEs, I always start, especially in the realm of law enforcement, I always start with the definition of community problem-oriented policing. If I had a group of police chiefs and said, everyone raise their hand if you practice community problem-oriented police chief or community problem-oriented policing, the chiefs in the room would all raise their hand. Well, if you look at the definition of community problem-oriented policing, it says engage partners in the community to get at the root cause of crime and social disorder. When I was promoted to chief in October 2009, I looked to other police departments across the state and the country and instituted things from departments that were practicing community problem-oriented policing, connecting our residents with mental health services, substance abuse services, housing services, trying to have the intervention to get them on a different path. Those programs are important and they continue today. But when I learned about the Adverse Childhood Experiences study, I was blown away. I said, if I'm truly going to practice community problem-oriented policing, I need to be focused on trauma in our kids. So things that we can do in law enforcement, things that we've been doing in this state, is that we can adopt policies from the International Association of Chiefs of Police and their work done with Yale Childhood Development Center, where police officers on the front lines at those situations where our kids are present to handle those calls for service in a way to reduce the dose of trauma. Handle with Care program, which is now mandatory across this state because of the work of Chris Yackham and other chiefs for Attorney General Graywall to mandate that program, where we enhance the awareness of risk to children exposed to traumatic events. It just requires a one-page form saying, handle this child with care. In Middle Township, we launched the program in September 2018, and we had 110 referrals. Those are not situations where a kid was in trouble, which was our typical communication. They were present or witnessed a traumatic event. Since the webinar last year, when you first talked about Handle with Care, a few weeks later, we held a 3-hour training that was mandatory for all 40,000 police officers in this state to view. And yes, it covered the logistics of Handle with Care, but it also covered an overview of the Adverse Childhood Experiences study and the impact of toxic stress on our kids. It also included a block on how officers can be trauma informed with themselves and connecting the program that is already in place through New Jersey for resiliency for our officers. Retired Deputy Commissioner Bethel from Philadelphia Police Department told me, we've got to give officers the skills to be trauma informed with themselves, before we can ask them to be trauma informed with the community. Police officers, day in and day out, year in and year out, deal with negative situations and see a lot of suffering, and they see a lot of terrible things. I don't know any other way to put it, that it just lives inside you. And it was really important for us that that was included in the training for police officers. Since the program has been launched, I've had police chiefs come up to me from across the state and show examples of how it made an impact in their community. The power of the Attorney General to mandate that is bringing ACEs and trauma into the world of law enforcement. I was at a police department a few weeks ago, and some of the officers were watching the film, preparing or watching the training to prepare for a promotional exam. That's getting this work into the realm of law enforcement. And then the final piece where we can make a difference is building connections with kids and having trusted adults, or trying to enhance the number of trusted adult in kids' lives. So some really good work going on in law enforcement around police youth camps. E-gaming and police officers after school is something we do in middle, also happening in Camden County, and other cross-sector collaboration to build connections with kids. I believe working on ACEs and helping our communities build resiliency and healing is one of the most important things we can do to impact people's lives in a positive way, prevent crime, and build trust in our community. And we're making progress here in New Jersey. Dave Ellis and his team and the work of Action for ACEs campaign is moving this state forward. We got more work to do, but I look forward to helping New Jersey reach that goal of becoming a trauma-informed state. Thank you, Angela.
Thank you so much, Chief, for that background information and explanation. Very helpful. And thank you for all that you're doing and all that you're focusing on in Middle Township and helping to share those messages throughout the state.
Thank you.
Special Agent Yakum, thank you for being with us. I know you've been committed to raising awareness and finding interventions to help children impacted by trauma for many years through the New York, New Jersey HIDA that you're the commander of, and through DEA New Jersey, and that you were instrumental in bringing the Handle with Cares program to New Jersey. So I thank you for joining us this morning to share with us some new developments on this topic and any other insight you can provide. Welcome.
Good morning. Thank you, Angela. I appreciate that. And thank you to you and your team, to Matt and everyone else a part of the partnership and all your great efforts in this space as well. To Kelly Levy and all the team at the NJ Cares, a great effort and a team effort that people are trying to move the ball forward within this space. So thank you for all you do. And Chief, as always, good job explaining what the Handle with Care is about, and thanks for all your sacrifices and efforts in this space as well to move this program along here in New Jersey. We look at Handle with Care as one component of an overall strategy within the state. How are we addressing trauma and adverse childhood experiences in our youth to mitigate all the negative effects that these ACEs and the impact that they have on them? And from a law enforcement, and particularly from a DEA and HIDA perspective, we look at this truly as a prevention program. How do we continue to get upstream, address these traumas earlier on so that later in life, we don't have our children going into teen and adulthood seeking drugs and alcohol to cope and manage with those negative effects of ACEs. So we continue on this path and this journey. And as Chief Lusner mentioned, in October of 2020, we had a monumental impact here in the state with the Attorney General directing that every police department in the state is mandated to implement and send these notices, this continued relationship between law enforcement and educators, so that schools have this awareness and can now apply the resources that they have available to mitigate that effect. So where do we look? Where are we in 1 year? And I think collectively, we still have a long way to go, particularly within the education and awareness spectrum. And we've been putting a lot of effort, as has many other entities and agencies, the Partnership for Drug-Free New Jersey, the Burke Foundation with their Actions for ACEs initiative, which is very significant and very educational on the resiliency and trauma piece. So what we've been doing as a follow-on from the DEA and HIDA perspective is we made a series of videos, and these are really testimonials of those who have been impacted from ACEs. These are ACEs survivors that have walked that path, that have experienced that trauma, and then the negative impacts of that trauma. And fortunately for the individuals that participated in our video series, they were able to overcome that trauma. So I'm proud to say that we're going to feature a video this morning. This is the first of several within this series that we're going to be releasing. And this is Mariel Huffnagle, who will be featured in this particular video. And her resiliency and strength and courage to be able to come forward and participate in this video with us is quite remarkable. So Matt, if you could play the video now, that would be great. Thank you.
When I was about 11 or 12, I started experimenting with alcohol and drugs. I think there was a lack of education around signs and symptoms and how to help in situations like that. Things really were kicked into high gear when I was about 17. Regular heroin and crack cocaine use, and that brought me to, homelessness and prostitution and incarceration. Really a very dark, scary, painful, hopeless place for about 4 years. I ended up, asking for help for probably maybe one of the first times in my life. Not only asking for help, but being willing to accept that help. Recovery happens in the community with holistic support services that address employment, education, trauma, housing, all of the social determinants of health. Youth in foster care many times are really child victims of atrocities. Things like sexual abuse, physical abuse, emotional abuse, abandonment, neglect. I think our childhood paints this, it dictates who we become as we grow up, right? And it doesn't need to absolutely be who you are, but it dictates your love map. It dictates your thoughts about yourself, others, and the world. Probably the most important message that people need to hear is that, we are born with innate worth and dignity. We are all deserving of love and compassion and empathy. And oftentimes our first responders are coming across these scenes, and because of whatever dynamic there may be in the home, the law enforcement might be the only individual who is able to share, with the school or with other stakeholders about what's going on, and open the door for that youth to be able to receive the resources and the support and that radical love that they need. And I believe that initiatives like Handle with Care around destigmatizing mental health and addiction, looking at how to be helpful and how to meet people where they are and de-escalate them and refer them to services is an incredible step in the right direction. My hope ultimately is that we talk about depression and anxiety and mental health the same way that we talk about physical health, and that, asking if I have a fever is no different than asking if I'm feeling a little sad today.
Like Marielle, far too many youth experience ACEs, short for Adverse Childhood Experiences. The Handle with Care program has helped mitigate the negative effects of ACEs. Partnerships between law enforcement and schools can help provide a safe, supportive environment for children exposed to ACEs. Please support and bring awareness to this important cause. Thank you.
Great. Thank you, Matt. And once again, thank you to Marielle. Very impactful and a journey that it just exudes her strength and tenacity and perseverance to overcome a lot of those challenges. So thanks to her. And I welcome everyone. Please, as I mentioned, this is one of a series. We have a YouTube channel that is set up. It's Handle with Care, New Jersey. There are other videos on there explaining in detail the Handle With program, the value of it, how to implement it, and those relationships that we continue to try to foster between law enforcement and educators who are dealing with our children every day within the school system. So once again, thank you, everyone. And again, partnership, thank you for all your efforts in this opportunity to present.
Thank you, Chris. And what an impactful video. appreciate you sharing it for the first time on this webinar series and providing that for a resource for all of our attendees. I know that you shared the link to your YouTube page that we will share in the chat, and it will be also provided to all of our attendees post event if you didn't catch that. But once again, thank you for what you're doing in this space and for helping to lead the way on not only raising awareness, but also, as you said, really helping the children of our state. And thank you again to you for being here, and thank you, Chief, as well for sharing what you did about the Handle with Care program to really give us that that understanding.
Thank you.
And so now I will turn the presentation over to Dr. Levine. Dr. Levine will give us an overview on ACEs, and Dr. Levine, thank you so much for being with us.
Thank you very much for having me. And thank you to the law enforcement for really trying to work to help to destigmatize mental illness, because it really is at the heart of so many of these problems. So my name is David Levine. I'm a pediatrician working in Scotch Plains, and I have known about ACEs for several years and have done some reading, and I try to incorporate it as much as I can into my practice. So next slide, please. I have no disclosures of any kind. Next slide. All right, so first and foremost, what are ACEs? ACEs are adverse childhood experiences. They are events in a child's life that can have a negative impact on their future health. The term comes from a CDC Kaiser study from 1998 that showed that childhood trauma can lead to the adult onset of chronic disease, depression and other mental illness, violence and being a victim of violence, and other social and financial problems. All of which can increase the risk of substance use and abuse. It was the first study to really link what you experienced as a child to how you become, not only physically as an adult, but mentally as an adult. Next slide. So what qualifies as an ACE? It's broken down into a couple of areas. There's physical, emotional, and sexual abuse, physical and emotional neglect, household dysfunction, such as exposure to domestic violence, substance abuse, mental illness in the home, parental separation or divorce, incarceration of a relative, and newly added is experiencing racism. Next slide. So how do they cause harm? They impact developing brains, which leads to changes in how the brain responds to stress. The traumatic levels or toxic levels of stress can damage immune systems by leading to the over-release of stress hormones, which can subsequently decrease the circulating cortisol levels, which leads to poor responsiveness to stress and poor coping skills, all of which increases the risk of substance abuse due to the need to help with coping. When toxic levels of stress are applied intensely or over a prolonged period of time, they alter the structural development of nerves, pathways, and the biochemistry of the neuroendocrine system. For anybody interested in more information about this, there's actually a book that's been on the New York Times bestseller list for the last couple of years called The Body Keeps Score, which I could highly recommend. ACEs lead to trouble learning from experiences and making sense of them, and leads to hyperactivity to stimuli. Next slide. Most Americans experience at least one ACE in their life. It's nearly impossible to go through life without having some traumatic experiences. The more that you get, though, the worse you may, and I stress may, end up being. There is a strong graded relationship. For example, an ACE score of 0 means you're of regular risk of having alcoholism to the general population. However, a risk of 4, 700% increase in the risk of developing alcoholism. It also can lead to a double risk of cancer and a quadruple risk of emphysema. Next slide. A 2012 Washington State University study looked at ACE scores, and above a 3, they found a 3 times likelihood of experiencing academic failure, a 5 times increased risk of school attendance problems, and a 6 times increase in the likelihood of developing behavioral problems. Again, all of which can lead to increase in risk for substance use and abuse. The takeaway is, obviously, the more that you experience, the greater your risk is. And this is all about risk. Next slide. But it is not a guarantee, okay? Resiliency, support networks, the love of friends, family, community plays a very strong role. And contrary to popular belief, resiliency is not innate. Most of it can be learned, which is very important. Coming from bad circumstances does not mean that the ACEs that you experience are absolutely going to lead to some of the things that I've just mentioned. So many other factors are in play. And that means that those of us in healthcare, in education, in policing, we can make a difference. Because of this, though, we must be careful how we choose to screen children and families for ACEs. Next slide. So individual screening is not well validated, and the screens that are available do not have a predictive value on an individual level. We must be careful when screening to not potentially re-traumatize. Screeners can be deficit focused, and all do not screen for symptoms and strengths. As I said, resiliency plays a large role, nor do they account for sex differences, difference in the timing of experiences, nor the extent of the experience. Screening is recommended to be part of a larger trauma-informed care approach. We need those that do decide to screen need a clear plan for administration and introduction of screening to the family, who will score it, and who will discuss the results and how those results will be handled. Next slide. We must remember that not every child who scores a 4 needs a referral. It depends on the symptoms, the functioning, and the supports and resiliency. Some examples of screening tests that are available include the Quick Parenting Assessment, or QPA, from Vanderbilt, and the Care Process Model, a pediatric traumatic stress screener from UT Intermountain Health. You can also see the National Child Traumatic Stress Network website, nctsn.org, and the American Academy of Pediatrics at aap.org/PATTER. So there's many things that are available, but as I was looking into this in my own practice, I realized that it is very hard to determine what the best way to screen for, and again, how to best deal with the results of your screening. So I've taken a bit of a step back and I'm trying to just do some more general questioning of social determinants of health. Next slide. Thank you.
Thank you, Dr. Levine. I think it's really important information and gave a really great understanding to our attendees. So I appreciate you sharing that with us today. I know we have a number of questions that are coming in to the chat. I just want to make note again that a recording of this webinar and the slides will be made available to all of our attendees post-event or on the website knockoutday.drugfreenj.org later today. And all of the questions will be presented at the end of our next speaker's presentation. So with that, I welcome Dave Ellis, Executive Director, Office of Resilience with the New Jersey Department of Children and Families. Hi, Dave.
Good morning. It is still morning. I'm finishing up a 3-day training specifically on adverse childhood experiences. We're training 30 people to take this specific curriculum into the Department of Children and Families and train all 6,700 staff. I just want to start out by saying the Office of Resilience is unique. We are a one-of-a-kind office that was created in a partnership between 3 foundations and the Department of Children and Families. I am not a state employee. I am a contractor, which is also unique. I am in a cabinet level position in the Department of Children and Families, so I am part of the Commissioner's executive team. And yet I'm not a state employee, and that allows me to do and say things a little bit differently, which has its pluses and minuses. There are 5 other staff with me, and we have a responsibility for developing and implementing a statewide action plan, specifically to address adverse childhood experiences across the state of New Jersey. And we've taken a number of different steps, and I'm going to try to walk through some of those here this morning. This office was created in June of 2020. And as I said, it was our charge to put together a statewide action plan. But one of the things that we realized was that we couldn't put together a statewide action plan without hearing from those who are most directly impacted. We had input from all of the NJ agencies, as I refer to them, the New Jersey departments of. And you can take that down to the local level. So all of the governmental agencies and nonprofits had input. The people who did not have input at that point were the people who were most directly impacted. And my concern was that if we did not have them at the table, we would end up doing exactly what we've always done, which is do things to them, but not have them engaged in the conversation. And so when we issued that plan, if you look at it, you will find that it is designed around 5 core areas that actually talk a lot about what the community wants. Next slide, please. This is what the work looked like when I first got to New Jersey. I moved here in July of 2020 after I took this position. And I like crude drawings. I asked my folks at DCF to make it glamorous, and I didn't like the way it came out. This hand-drawn picture is more like what I believe it is. That there was a lot of work happening in New Jersey, but it was very disjointed. And so one of the first things that we started talking about was in this plan was how do we begin to bring all of these pieces together? Next slide, please. So as we looked at what that plan should look like, we came up with 5 core strategy areas. And I want to spend a little bit of time talking about each one of these because they are significant. The first one was to achieve a trauma-informed and healing-centered state designation. We took this on because we believe that just being trauma-informed is not the end-all, that we want to move into a space of healing and into a place of prevention. I heard someone mention upstream a few moments ago, and I agree with that, but I don't look at it as a destination. I look at it as the direction we need to be going. As part of that, we created what was originally a trauma-informed healing-centered technical assistance center, which has since been renamed at the community's request to Healing New Jersey Together. And so we are moving in that direction of how do we become a healing-centered state. The second core strategy was to conduct a public awareness campaign. And you heard mention of Actions for ACEs. Actions for ACEs is a public awareness campaign that is targeting law enforcement and educators to bring them up to speed on adverse childhood experiences. And yes, there's been a lot of training that's been happening. One of the things that as we've been doing this work around trauma and adversity is that we've come to realize that in addition to doing the training where you're sitting, there also has to be an opportunity for a change moment. Otherwise, it just becomes a check off the box kind of training. And in this case, there is a much deeper conversation that has to happen. The Actions for ACEs campaign, if you go to actionsforaces.com, you will find that there is a toolkit or multiple toolkits with everything from videos to posters, bookmarks, you name it, it's out there. They're all available for you to pull down and utilize at your discretion. There is a push now that will increase that public awareness to the public itself. So we are looking at how do we begin to move this into the public domain and specifically into the communities who are most directly impacted. And you keep hearing me say this because they are the ones who are never in the conversation. We train professionals constantly, but we never give the same information to the people who are most directly impacted. And so there is the next phase, which is moving into that space. We look at community-driven policy and funding priorities. The Department of Children and Families, we just released an innovation microgrant process where we are moving $3 million deeper into community. The word micro is not designed around the size of the grant. It is about the size of the organization. We are looking for ideas from those people who rarely get funded or never get funded through state processes. We are looking for individuals with ideas that might be the next great program that we can pull together and actually facilitate. And so we're going to follow through on that commitment. These 5 things that you see are things that the community said was important to them. And so we designed it around that, with input from all of the service providers and state agencies. We have the core strategy number 4 about training. As I said, we are training 30 people right now. We just recently trained 30 people from CASA, from the court-appointed special advocates, who are training across the state, along with approximately 150 other individuals that are trained to use this curriculum to go out and create that groundswell that we truly need. And so for any of you looking for training, we most assuredly, if you reach out to my office, you most assuredly, we can begin to set up something to help you begin to do that. We're also looking at all types of pieces around becoming that 5th piece around trauma-informed healing centered services and supports, about how do we make sure that this information is moved? Is there a cost for the trainings? We'll get to all of those questions. I love those kinds of questions. Quick answer, no. Not at this point, there isn't. There probably will be by the time I'm done today, simply because there will be inundated and trying to figure out how to do that. But the last one here that talks about being trauma-informed and healing-centered, we truly are trying to figure out, how do we move into that space, right, of being healing-centered? And so we're taking this on as a pure challenge as to how we do this work. Next slide, please. So I talked about what happened at the beginning, and then we released this statewide action plan. And this is what the world turned into in the state of New Jersey. It was like there was an explosion of activity and connectivity. At the beginning, there was really not connectivity between North, Central, and South Jersey. And someday I want someone to tell me where the line gets drawn that tells me what delineates North, Central, and South. And I know folks are going to start putting that in the chat. But what I found is that no one has been able to give me the definitive yet. And so I'm still looking. I'm hoping it'll get cleared up. But the point here is that the work now is connected. We're finding folks in North Jersey, in Passaic, who are now working with people in Central and Asbury Park, and people in Asbury Park now talking to people in Cape May and down in Middle Township. And so we're beginning to see a whole new way of doing this work. And that's a part of what those innovation grants were about, is how do we begin to catalyze a way for people to talk to one another? The biggest issue that we have around all of this is that we're in our silos. And I'm not saying silos are bad, but we need to be talking across those silos so that each of us knows what the other is doing, that we can connect and actually then begin to have a greater impact. This conversation today is specifically about substance abuse. And so I want you to go to the next slide. And I want you to think about, as we go forward, this is what we envision in our future of how we do this work, that those lines become darker, the connections, that big dot in the middle is the Office of Resilience. We want to be a connector. We want to be able to provide you with information, training, and recommendations. If we have a virtual learning community that, again, if you go out to the Office of Resilience website, just go to the Department of Children and Families, hit the Office of Resilience webpage, and you'll find all of these resources I'm talking about. We have a virtual learning community that literally, when you want to do a trauma-informed assessment of your organization, we've done a review of just about every assessment that's out there. And recommendations are out there. We'll tell you the good, the bad, the ugly of all of it. We've looked at the trainings that people do across the state, especially those associated with ACEs. And there are recommendations on how to proceed as we go forward in doing this work. But again, those dark lines, those are the connections, the greater connections that stay in place. Now, again, as I said, this is about substance abuse, and we've talked some about ACEs in a very quick way. The trainings that we do around ACEs are specific, and they are 3 hours long. And we spend time, and you can contact me. I'm sorry, I can't resist myself when I see these things come up. I can't resist responding to them. And so my contact information will come up here in a little while, and they'll be able to refer you to my office through this webinar. But I want to just give you some statistics about ACEs. First of all, the first thing I want to tell you is ACEs are not our destiny. Just because we have these things, ACEs are events. You know, we just released a screening, a document, a position paper on screening. And unfortunately, what we're saying is very different than what may be happening in the state of New Jersey. We are not supporting screening. And the reason we're not supporting screening is that the questions were never designed for that. You're talking about us using a number for an individual when the entire piece of that, the entire study around that number is about community health, not individual health. And so you can't use cut points. We just spent 2 hours this morning with these 30 folks in training explaining why you cannot use cut points. It doesn't take into, and I wish I could get into this, but I don't have enough time to really fully explain. Right now, Dr. Rob Anda, one of the co-principal investigators, is doing this training right now. And so what I will tell you is there are many reasons not to do screenings. One is that we don't have to. As the doctor said, most Americans in this country, you can't live here and not be impacted by trauma. Look at what's happened over the past 18 months with COVID, and look at the trauma from that. Think about even something as simple as the insurrection at the Capitol, which wasn't simple. We watched what happened with police kneeling on George Floyd's neck. It's been repeated over and over and over. There is no way we cannot be traumatized, so we don't have to screen. The only reason in my mind for screening at this point, and I don't even call it screening, what I talk about is use it as a way to engage your clients. It was designed to be a way to gather information, not for diagnostic purposes. This is not a disease like heart disease or lung disease. This is an event that happens in someone's life. And to put a label on them for the rest of their lives, which is what happens. There is no way you can avoid the label. The other piece I will tell you, I've had this conversation, I just had it with the National Governors Association yesterday. When Medicaid is the organization that pays for the screens, who receives Medicaid? You're talking about red, black, brown, and poor bodies. So what you've done is commodify bodies so that we can collect a $29 fee for doing a screen. Once we get that $29 in our system, we will not let go of it. So I'm not saying don't ask the questions. I'm saying don't use it as a diagnostic tool. Our position paper is very clear. And if you want to copy it, like I said, everything is out there on the net. And so please take a look at this. And the last thing I want to leave you with before I close this off, some numbers. So they talk about population attributable risk when they're talking about epidemiological studies. Sorry, I'm losing my concentration. So when we look at substance abuse and adverse childhood experiences, think about this, 54%, and these are things that when they look at it, they say, these are things that this percentage can be attributed to ACEs. 54% of all marijuana use, 32% of all alcohol use, 67% of all suicide, 67% of life's dissatisfaction. And the numbers go on. I can send you, if you're looking for citations, and I know lots of folks, because I'm not a researcher, I'm not a physician, I stand on the shoulders of those who are. And so I have all of the citations for all of the numbers that I'm giving you. If you want those, we can give you those also. Next slide, please. And I want to wind this up. This is simply putting them all together, talking about how we see this, emergent, current, and what we see in the future. Next slide. There you go. I'm sorry it took me a little while to get there. There is the address to the office itself, dcf.officeofresilience@dcf.nj.gov. And I have the same basic contact information that every state employee has, dave.ellis@dcf.nj.gov. Thank you very much. I'm sorry, I probably went way over. And I had so many more things to say. Thank you very much for listening.
Thanks so much, Dave. No, please, don't apologize. I think, your in-depth presentation is what everyone was tuning in, to see and to get information on, and appreciate everything you shared. I'll give you a moment, and we, as a follow-up to your presentation, but I'll bring it to Dr. Levine first, and then Dave, if you could give some feedback on this question. So you mentioned obviously the things that children are seeing and youth are seeing in the news, and all of the traumatic events of January 6th and George Floyd. And so my question is, with COVID-19 and the disruption to school, and so many people who have been sick or dying or hearing about it on the news, Dr. Levine, can you speak first about what impact do you think this pandemic will have, and what we can do to prevent that trauma or to address it? Can we start with you, Dr. Levine?
Sure. I think, well, one, I think we shouldn't get confused. I think we shouldn't be aiming for, I don't want this to sound weird, prevention. I think things are going to happen. And if our main goal is to stop it from happening, I think we're going to miss things. I think first and foremost, we have to address it. And I'll speak in a primary care office. I know if there are doctors or primary care practitioners on the call here, we have a limited amount of time to do a lot of things. And all of us will prioritize different things, but I think one thing we have to prioritize is mental health. And I think we have to prioritize that from the very beginning. It's not, I mean, you can't ask a 2-year-old how they're doing, but you can ask a grade schooler how they're doing, and you can broach this topic with the parents. What I've been doing for the last, pretty much since the pandemic began, but definitely since kids got back to school and in different communities, only virtually versus in hybrid last year, is asking the parents, how do you think your kid did during that time mentally? And then addressing it with the child too. Because you're right, not a lot of children got very sick, thankfully, but a lot of them did experience loss of caregivers, family members, close and distant, who suffered greatly during the pandemic. And one thing we have to go out of our way to do is ask those questions. I think, part of my background, I actually suffered postpartum depression, which a lot of people don't know occurs in fathers. And one of the things that changed about me was I started to address mental health a lot more from the very beginning with parents, that this can be hard, and you have to be able to to talk about this, and talk about it from the very beginning, so that families understand that, yes, like in that video, we're going to talk about the cuts and the bruises, and we're going to talk about how you're doing in school, but we're also going to talk about how you're feeling, and we're going to make that as normal as asking if your throat hurting or how high your fever was. And I think it all starts with just broaching the questions and making sure that people understand that when they come to a doctor's office, or they talk with law enforcement, or they go to a school, that they're not going to be stigmatized, and they're not going to feel like lesser people, or that someone's going to be knocking on their door at home because they said that I was having a really bad day today. So I think it all starts with just starting the conversation early, so that way when something like this occurs, and like Officer Ellis said, it's going to occur. Everybody suffers from some trauma. That they already have an open forum to talk about it.
No, thanks. And we'll bring that question, Dave, to you next. But before, I should say that Dr. Levine, the Partnership for a Drug Free New Jersey, has made the cornerstone of our efforts, parent-child communication for substance use prevention. And so to be able to continue those messaging to help eliminate this or address the trauma is important information as well. So appreciate you sharing that. But Dave, can you go ahead and tackle that question as well? What impact do you see the COVID pandemic having, and what have you seen?
Well, the one thing that I do know about COVID is that it's changed how we view everything. We did not believe that we could teach our children out of school as parents. We weren't believing we could actually do that full time. The jobs that we do. When I was doing training around ACEs, I kept saying, there's no way I can do training virtually. We found out we can, and we can create the same intimate environment that we have when we do them in person. So there are ways of doing things. So when you think about our children, think about what happened to them over that 18 months, and for some of them now still, the social interaction that was taken away. We know that domestic violence and abuse in the home went up. And so there are things that have been happening that we're not paying, in my head, we're not paying a lot of attention to. And I look at this way. I am not, if you think about population attributable risk, again, the epidemiological piece of this, and you ask yourself, how many people died from drug overdoses? And you think about what percentage of that would be attributed to ACEs just based on the adverse childhood experiences study. That's an astronomical number. And understand, we're not born with ACEs. These are things that we inflict. These are things that we watch, that our children learn from watching us, things that we do to our children. I mean, domestic violence, sexual assault, all of those dysfunctions. And I want to add that the ones that we talk about are just the 10 that are there. There are more. We know that bullying is an adverse childhood experience. And usually people who bully were bullied as children themselves. But I look at this and I see across children, when I think about it, there are so many things that are impacting our kids adversely. And COVID is just one of them. I see it as one more thing.
I agree.
Thanks, Dave. Chief, are you seeing any different impact, or are you seeing any impact of COVID intensifying anything, in your level?
I can just tell you from our discussions with the schools, there have been some challenges, getting back to in-person learning and, behaviors that the school believes, are related to the pandemic and being in hybrid and missing out on the socialization and some of the other things that David talked about. I think it's something we have to think about. I can tell you in terms of, trying to connect with kids with the work that we were doing in other departments across the state. We had to cancel our police youth camp that one year, but we then had an ice cream truck where we tried to have limited interaction with kids. We had police officers reading stories virtually to try to just, keep that touch point there with the kids. But it is something that concerns me. And, I think there's some long-term consequences that are going to result. But if we know better, we can do better. And the fact that we're talking about it and have that awareness is something that gives me some hope.
Thanks. And I have another question for you and Special Agent Yakum. There's some concern that we're seeing in the chat, just people who are worried that kids will be labeled if it's found out that, I guess, Handle with Care was used for them, or they were identified. Can the two of you speak to that? Chief, if you want to kick us off, and then Special
Sure.
Agent Yakum, if you want to
So-
jump in if you have anything.
This is just a one-page form. It goes to the principal, does not go in the student's file. The teachers are not to discuss the incident with the child, to not re-traumatize them. It's for awareness. So that if the student does exhibit behavior that they were impacted by the event, that the school does not compound the trauma. That's the goal of it. So that if there's a behavioral issue or the student didn't do their homework, that they're not compounding the trauma because they're not aware. that something happened the night before. So it's just the name, date, handle with care, does not follow the student. And, you know, we're very careful about the confidentiality piece, and the Attorney General was very careful in drafting the policy, and also making sure that we reinforce that point in our training, and also say what's the, you know, if we do not make this referral, I think the consequences are a lot more negative and not what we want. You know, I can give numerous examples of where, you know, a child exhibited signs the next day and the school took a completely different approach because they had that awareness that something happened the night before, but they do not discuss it with the child. Not even, oh, I understand you had a rough night. Them even knowing in some of these circumstances that someone knows that something happened the night before is an issue. And then in some circumstances, unfortunately, in the referrals, you'll see some kids have multiple referrals throughout the year, and that awareness to make sure that there's you know, support and a different approach with the school to be more compassionate and have more empathy, I think is really critical.
Thanks. Special Agent Yakum, anything you want to add to that?
Yeah, I think the chief did a great job articulating that. I mean, we encourage the schools to silently monitor that child, right? We don't encourage them to go and approach the child first thing in the morning. Hey, what happened last night? You want to talk about it? It's really to see if their behavior, what it manifests that day, knowing that something happened, but not specifically what happened. And now they're able to attribute whatever resources that the school has, you know, and that varies throughout our state as far as resources. But something as much as a trusted teacher, someone showing that they care, that, you know, here is an avenue, here is an individual who cares about you. And if you want to discuss this, it's open, right? We can have that conversation. But again, we don't want to re-traumatize that child where now the child is wondering, well, who else knows? Do my peers know? Now they become embarrassed, and it really, there's negative consequences to that. So I think that silently monitoring that child and then addressing it with resources once the behavior manifests itself is the goal.
Thanks, Chris. I know we're coming to the end of our time, and so I just want to go to all of our panelists. We'll start with you, Dr. Levine, and if everyone could just give one last thought, one takeaway for all of our attendees. What's something that they can do within their community, within their school, within their practice to, you know, to make an impact in a positive way? Dr. Levine, we'll start with you.
I think it comes down to having the conversations, like that question that was asked. Parents are worried about stigmatization because the mental illness carries such a stigmatization. And if we can be more open and talk about it in our communities and with our friends and our families, in our practices and in our schools and elsewhere, it only helps to decrease the stigma. People are more comfortable talking about it, and they realize that getting help is not a sign of weakness, but is a sign of strength. And it all plays into what we want, which is for our children to grow up as healthy as they can be.
Thank you. And Dave Ellis.
Couple of things. One, children do not exist outside of the context of families. So let us keep in mind that when we're doing things with and to children, we're doing them with and to parents. And so all of those concerns we have around our children and their mental health, we need to be having them around their parents too. Lastly, 2 out of 3 children have at least one adverse childhood experience, but 3 out of 3 adults can help. And I think that's one of the messages we need to be having here, is that caring and competent adults can help us figure out how to deal with this. I mean, having those relationships with children. And so let's figure out how we do this. What's your commitment? What's your actions for ACEs? Thank you.
Thank you. And Chief?
Yes, I would say that you never know the impact that you're going to have on another person, especially a young person. You know, I have a few officers that came from very challenging circumstances. One of my officers, we first met in 7th grade. And, you know, when I met him, he was living with his grandmother's boyfriend and he bounced around a lot. And he is the director of our police youth camp here. He is really engaged with our youth here. And I talked to him about, you know, how he overcame his challenges. And he talked about a teacher. He talked about a police officer. And you talk to those folks and they say, what did I do? I didn't do anything. I spent time with him. I talked to him. He felt seen, right? And they had no idea the impact that they had. And I think that's the message. You never know the impact that you're going to have in another person's life. And whether it's a police officer, a teacher, a parent, you can do something. If we all do a little bit, that can be lots of times enough to really make an impact into people's lives. And you have no idea how far that goes. So that would be my message.
Very, very impactful to think about that. Chris Yakum, before we go to you, I just want to mention to everyone that the evaluation has popped up on your screen. If you could take a moment to complete that. And Chris, we'll go to you for the final word.
All right, thank you, Angela. Yeah, I think that we collectively have to remain very vigilant within this space. I think we're doing a great job statewide, bringing this awareness and education, but it can't stop there. The more trainings, the more awareness all cross disciplines that people, you know, if we could take on that mentality when we look at our children and how they misbehave, it's not what's wrong with them, but what happened to them. And I think if we can look at it through that prism and try to drill down and say, you know, there's a lot more behind those actions as to why that child is displaying whatever those types of behaviors are. So that vigilance, continue to learn and continue to educate those throughout the state at all sectors, public, private, is only going to make us stronger and build our future leaders. So Angela, thank you to you and the team once again. And it's a pleasure being a part of today's event.
Thank you so much. And again, thank you to all of our attendees. I've been monitoring the chat and some of the great suggestions that you all have regarding, more education on mental health for teachers, as well as engaging the faith community. I think this was the second event on this topic that we included in the Knockout Opiate Abuse Learning Series. And we're definitely going to look in 2022 of adding another to continue this conversation and to, as Chris Yakum said, to move it forward. So I want to once again thank all of our participants today and all of our panelists. You all came from different perspectives, but I think really told the story that needed to be told today, and appreciate all of the information that you shared. As I mentioned before, we've been sharing some contact information and websites in the chat, but we'll also include them in the post-event email that you'll receive, along with a link to the slides from today's presentation and a recording. Thank you so much. Thanks again to NJ Cares for their partnership and collaboration on this event. And I wish everyone a good day. Be well.